living anatomy. Now so we can take reference material from our models and then start to draw from the model. We'll focus on now the upper legs. So I've got the image up in here. Pretty interesting image. You don't get this particular shot in your classes that often because of the upward view of the model, and then obviously the private areas of the model are kind of a little bit more front and center. So these are good to be kind of away from class, where it's a little bit, you can be a little bit, I suppose, less discreet, and then you can study this particular area because it is important to study the inner leg, thigh, the abductors, and then of course the outer leg too. So you get both of that. So I'm going to go ahead and lay these in, do a little bit more lay-in with some of these videos. I have requests to go ahead and show some of the lay-in, so that'll be fine too. So the first thing I'll look at is the overall action of the model. You can see the pelvis really come out. So see how it's in this kind of position, anchored and then tilted over. It's pretty powerful to see. And you can see those crests already emerging pretty much at an angle here. So we have the lay-in. I'll get the outside here and then come on over and get the other side just to feel that kind of box. So we want to reduce now the complexity of that form, the pelvis, into a more manageable form to work with. So I'm thinking it as a box as I'm coming through, kind of like this, right, and over, like a pelvic girdle, if you would. So sometimes that's all I might need, just that outer part of the pelvic region. Now I'm going to feel the rectus abdominis muscle coming over just gently right in through here and sheathing over. I'm going to eliminate the genitals for now. I don't think we don't need those. I'll kind of just reduce them to a curve or two. You can study those forms on your own. Essentially egg forms and cylinders. I think that pretty much will cover that. And so kind of feeling the pubic tuberosity as right in through here coming downward and across, and then we've got the little part of the ischium that would be down in through here and then over across, and then might even disappear on this side. Also, what's interesting about this view is we get a little bit of the glute, which is going to be interesting behind here. So I'm going to go ahead and gesture out the rest of the legs here. So find the gesture, which is almost kind of like a bone, isn't it? And through there, almost like our femur in through here. Then also, as we tilt up and over now, the gesture of the other femur, up through, and then down and over. So notice I'm keeping my drawing super light, through here and over. So knee to knee and through here. Then I'm just going to get the basic feel of the leg, the gesture coming through, and maybe a little bit of that torso. See if we're still in camera just a little bit. Up and through here. The oblique, see how the oblique really pulls off of the pelvic crest and through there, iliac crest and through, really coming over and down. Really a nice tense spot and through there, and then it wants to go way on back through there. That's part of out of the camera. Then we'll get the gesture here of the other leg coming up and through. It'll be boxy, but down here to the Patella region and then over. So there's a pretty standard kind of gestural, structure in through here from our model, so we can start to pick this apart a little bit. We have that glute coming back over. Okay, and then we'll come down and we'll see this crest now on this edge. We'll see the crest here emerge, right? We'll get maybe a little bit of the oblique tensor and through, would be up and through here, and of course the Sartorius now will be coming down later on. We may or may not, we see maybe a little bit of that. So we have the crest, I'm thinking on the outside, in through here, okay? And then now all the way, I'm thinking over, we get a little bit of this top part would be the Rectus Femoris, right in through here, and a little bit of that part of the iliac crest, the anterior superior part of it, of that notch coming through now underneath, filling the thigh, over and down and under. See how this gets really rounded, kind of right underneath the penis, right in through there. So we see this coming in through, and we get these abductors now coming through, and then the flexors now also of the semi-tendinous and membranous coming down right and through here. So I'm feeling that, okay, as we're drawing them. Of course, this is going to be shadow right in through here already. Pretty much all that's in and it being shadow tone. Then we get underneath here the glute, which will wrap over that. So a little bit of the gluteus maximus now in through here and around. And how about that coming through? So that's pretty powerful right in through here, and those abductors will come up, or flexors will come up underneath in through here and disappear a little bit. And the adductors will come off of that in through here. So we can see now, I'll mark this muscle here, make this crest, pubic crest a little bit more pronounced right in through. You can see it on his personages right here. It's a great model for this this kind of study right in through here. You see these muscles pulling off in over and down, a little bit of the oblique pulling down in through here. Here we get our center flow of the rectus abdominis till about now slightly underneath the 10th, probably at the 11th rib. We get a little bit of the navel belly button still in camera, just a little bit, yeah, right through here and down and over. So we get a little bit of that coming through, and a little bit of the underneath the rectus abdominis and through here. And this kind of sheaths wants to come down and in and up over center part here. So now getting back to the leg, we get this straighter part now, right in through here of the area of the three-fingered gap where the tensor fascia lata ends in through here. And what we're getting coming over now is the rectus femoris now in through here, coming up and over. So it's straight in through here, then it would come under that line, right, and up, back, and through, and attach to the inferior superior crest right in through here and over. So we're going to start to see this muscle now emerge even further. We get that beautiful kind of curve coming down. This sheaths over, right, sheaths. We see that coming through, and we see now this beautiful shape of the shadow right in through here, right? So we're coming down through the shadow, the shape underneath. We get this really nice kind of cut in. It's a really lean muscle material without much subcutaneous fat on it through here. And then it starts to end, and then we get down in through here. So we'll put a little bit of more of this on here, right in through here. We get this turning, right? And so underneath that, we have the Vastus Intermedialis, of course. And then let's start to put now on the Vastus Medialis, coming from beneath the trochanter, right, which would be buried under there. Over here, we might see a little bit of it coming up on this high side over here of the pelvic crest coming down through, and it would be bumping out, roughly right in through there, maybe a little bit further in actually, probably right in through. We have to be careful with that, right in through there a little bit. All right, so coming back over here to the medialis, Vastus Medialis, so it's bulging here, starting to make an appearance, coming down, gets into a teardrop shape, right in through here, okay? Then heading out, splitting now, and letting the femur do its work right in through there, okay? So we start to see the femur emerge and come out. So I'll put these little darker colors in through there. So that femur wants to come out, right? And then right on top, don't you see the patella right there? See that triangle part of the patella make its turn? And the whole thing is starting to turn and go back to the tibia infibia in there pretty powerfully. So we get now the curvature of the sesamoid bone, right, which is the patella and over, okay? We'll throw a little tone on it through here. And we'll see it now, the patellar tendon and ligament are here, okay? So we got with the tubercle now of the tibia, and then we're coming around like a box, remember that? So we're coming over here and coming down. And if I go a little further now, I've got a little bit of camera space left, looks like. So we have the medialis right in through here. Remember, that's going to go into a tendinous head over through here. It doesn't really show much. What we get is kind of a shadow shape that's going to get a little distorted. You have to be careful, because then we have art, we have anatomy, and then we have art, okay? Meaning that anatomy is controlled by design in art. Okay, meaning that you don't draw everything you need for anatomy. I think that has to be said to students. So come back over here, the flexor, I'll come back over here, get this straightens out a little bit with the flexor, semitendinous membranous over, bulges, and then wants to start to come back in. Now watch this, it's going to come down, and the reason why I'm getting this back over is that it's going to come down and over and underneath and finish out this side of the leg down below, right in through here, and as it comes in, it's attaching now to, kind of sheathing over the femur a little bit, but really getting back in and attaching over here now to the inner part of the tibia, over and through here, and this comes behind. So the gluteus, the calf muscle, the gastrocnemius. There you go. Thinking and drawing. Try it, folks. I should be pretty good at it. I've done it for a long time, but still, every time my brain gets tripped up a little bit. So, forgiveness right in through there. Okay, so we have that now coming down, and this will come out. And so that gives us the fullness back here. Those are the flexors, okay? Now they're not as fibrous and meaty as we can see them oftentimes, right, in our diagrams. That's why diagrams are diagrams, and then we come to start making a little art. We draw what we know too as well, and then we start to adjust to what we see and know. That's the trick also. And the hard part, I think, sometimes of all this as well. Now, as we come on back down here, let's continue on. And by the way, I'm using the polychromos kind of colored pencil. They're waxy-ish, just to, I think, just to vary things a little bit for students. Okay, and then we're coming back on down, and we see the medialis here. Okay, and it really bulges this way. We're on the side medial part of the leg. This wants to turn now over, so we see this turn like this, where the rectus femoris ends right in there. It gets touched by now the medialis, and this always has this beautiful kind of teardrop shape generally on the side if it's with a developed model like we have here. This model is perfect for this kind of study. This model is from Croquis Cafe. Again, they're wonderful. I don't get any monetary feedback from them or kickback. They're just excellent. So check them out on YouTube. They're a wonderful resource. If you can, donate. Right in through here, so that it gets more definition under here, and then we'll see again the flexors through here. But also now right in through here, this is part of the adductors. Remember, we don't want to forget them. So they're coming down here. We get a little bit, if you come right in here below this, right in this shadow area, I'm going to indicate now the penis testicle area just for understanding. Right in through here would be, so we can kind of get it out of the way. Just kind of just testicle wrap. That's enough for now. These are starting to be the adductors in through here, right in through here, the longest right in through here. We see that come up, and you can see that I'm going to make more of an issue out of them right about here. The top part here, you can see this here emerge, longus and brevis area right in through here and over a little bit. See that line I'm making and coming down? I think that's the longest. I say I think it is because it's our positioning and where it's at, and it's kind of a cylindrical shape. It could be the pectineus, but I don't think it's that large. So this feels like the longest to me, and so I'll just cap that in a little bit there. So we have that. So we're coming down. So we're feeling that over, and I'm just going to throw this in a little bit more shadow. So we see that this is the glute behind there. Okay, so we see that coming through. Okay, so we have that nicely. Now right in through here we come down, and this is where those adductors meet up with the medialis. Okay, and they're coming through here. Show that, then they're coming around, show this. This gets all in shadow. This gets a little bit more hollow since the adductors end. They're coming back. Remember, they're coming back to the femoris, the linea aspera line, right in through there. Down under and behind, remember the the femur there. I'm just going to tighten that up a little bit. So we see this coming down, right? And this over here now, this bulge over here, we start to see or feel the sartorius and the gracilis come in through this area and give it a little bit more bulk, maybe right in through here. We don't see them really stand out, so we don't draw them as if they're standing out. We draw what we want to see, a diagram, we can, but here we have a little bit of pull, and so we're getting here as a little tendon over through here, but also a little bit of the feeling of the pull from the sartorius and the gracilis right in through this area. So if I was to tighten up a little bit here, we would come over and say, okay, we have a nice curve in through here along this side, abductor in through here, flexor coming over now underneath, and this would feel like the sartorius coming over and the gracilis both making kind of a move in through here. And what we get behind this patella right here is tendon material from all of that coming in together. So let me put all this now in shadow over the patella. We have a little bit of this top, it's kind of like a box in through here and downward. Then we get this covered over. Okay, and coming on through and down, and you can see where the tibia starts to emerge as the bone, as this gets real thin on this side too, coming over right down and through. See this curves down, watch this little gesture here and here, and you see that's the tibia. It's really bony in through here at the ligament. So I'm going to start to put all this now back in shadow here, okay? That's going to go back in shadow and through there. And now we can go a little bit deeper with it and say, well, this was the patella here across and through here. And then we had a little bit of darker area because of its thickness. Under here, we see a little bit of this material of tendon right in through here. And then we get this connection, the sartorius and the gracilis over and through here. So you draw what it's giving you to as well with aspect to the model right in through there. This straightens out right in through there as well as you're learning to control anatomy back in through here. And of course you get the gastrocnemius in through here. Just know that the sartorius, as it comes down, it'd be way up through here and gracefully coming down this way. I'm just going to keep it really light right in through here. This is pulling this way, like so, kind of turning and pulling that way. And it's important to note that they're there, but you don't have to denote them by drawing it all the time. This is going to come in a little bit in through here. So we have that. We're going to pull down in through here. We can see the rectus femoris come over through here a little bit and over. There's a little bit more of a gap. We start to see right in through here a little bit further. And then let's just make a little bit of our core shadows clear. As this comes in, this wants to bulk in this way a little bit. Then we can come down and tone this through. Use this darker area for a little bit more core shadow. Through here and around. Okay, and then this gets a little bulkier, so we can see this little contouring approach that we have here. Around, through and over. And then coming up a little bit to the adductor. And through here to the testicle part, right? Yep. And through there and over. And then this is where the flexor will go up to the ischial tuberosity, back up and through there. This will turn down. And then we have the glutes through here. And I think we've got what we need now for this stuff. Let's put a little bit maybe now on the patella. Just a little bit, just right in through here. We can see this little bulge right in through here, maybe with a little lights coming over it. Maybe in this area of the leg. You can see that come down. Then on the patella head, just a little, just to bring that out, maybe just a touch. Maybe you want to catch a little bit of atmosphere back here. Just a little, just to pop that out. Under here we can dig into here a little bit, and then we can just see how triangular that patella is. Really, isn't it running through there? So I can pop a little dark in through there and make it feel like a cavity. Now in between here, this will come downward. So we're starting to see now the place where the meniscus would be for cartilage and articular cartilage, and through there to give that some space and also some flexibility of not grinding together. Overlapping it through here. There we go. Turning around in here, and that's where that bone is. You see that tibia turning through here. The fibia is on the other side. We're on the lateral side, so we're not on that side to see that. Cuts in through here. All right, I think we've got everything we need now. So I think we'll go on to another study, and we'll do a different outside leg. I just want to get that one in located together. So as you do these, you know, get a little bit of all this going together, and then kind of isolate one. So I think we'll go on to another. That way we can see many different poses, different legs, and so that would come down. You can continue on through, and I'll do a quick little contour here and over, just to get it all in. Abductor here, okay, around to the side, pulling, coming over. Look how bony that gets, and through here and down. Iliotibial tract, we can start to see. We get a little bit of the flexor back here, or the Vastus Lateralis, probably more accurate. Coming through, yeah, for sure. Then we get a little bit of that condyle right there popping through, and then the Sartorius bulky head coming through, and then into the bone. And we're kind of on our way, and I can just delineate a little bit of the medialis and rectus femoris, separate those two a little bit underneath here over to the patella top, and we're kind of on our way a little bit. All right, let's go on to our next study here. So now we have a standing female from a back view, and let's start to lay in now the relevant features that we're working on. So the back of the legs and the glute area. So I'll kind of start in through here to lay in sort of around the lower Erector Spinae area. We can work on this, make this a little bit bigger study, so you can start to see this gesturally kind of come together the way I'll work it out. So coming through now with this box, and we can start to see where this pelvis is, kind of a classic box bowl shape. So that's what I'm thinking about my lay-in through here. This is kind of a bowl shape in through here. It's the center coming down through now, and over, splitting the glutes into two and over. So there's a little bit of a gesture in through there. And the Erector Spinae would come up and out here, and the side over in through here for now. And so I'm feeling also the back of the sacrum now, about right in through the end of the sacrum to the coccygeal area, roughly about right in through here. We'll just kind of mark it for now. It could be off, could be wrong, which is going to turn us up in through and over to here, to the pelvic area, and you can start to see it coming through. And look how we have a strong tilt now this way, right, don't we? So we want to keep that in our mind, this kind of curve across here and over, and then that same feeling is over here. So if I can find out where my crests are, my iliac crests, then I can also find out or where my sacral coccygeal area, I can start to find them together in my composition. Now this would turn in a little bit more this way and get wider. And so I can just kind of pinpoint a little bit where some of these areas are. Then I can start to get into where maybe some of that dimpling is in the back. So I'm looking a little bit where the spines come down to the ends of the sacrum, running through here, this little divot that it makes, that triangular spot. So here, here, and then under here are going to be helpers to look for in kind of defining that convincing, you know, kind of area in through here. So kind of coming down in through. So in through here I see a spot, and over I see a spot roughly in through here, which would put this in, in a little bit, and downward coming through, and then the bottom of the sacrum about right in through here. So that's kind of what we're looking at for the sacrum is. That helps quite a bit. Gluteal split now in through here and over. Now we're seeing more of the hip, the glutes, the sacral spine on this side, and then the trochanter. See how the trochanter sticks out roughly here, so you can see that really start to bulge. So I'm just going to feel it for now, and if I get it wrong, I'll go back and correct it a little bit too as well. And that would put the other one down roughly in this area, and we get a little bit more curvy, lower bump, and then curvier kind of down through that area as we're starting to craft our drawing. Now coming through now, gesturally speaking, I'm feeling these kind of legs together. You know, the flow of all this is, you can see it down through here. Of course, this knee now is much, much lower. And you can see the end of the crease, where we see that beautiful crease at her back of her leg, where the biceps femoris and the semi-tendinous and membranous together, the flexors are ending kind of in the middle of the condyle. Of course, the calf would come out of it. This knee then would be pushed back. We see a little bit of it kind of coming out that way. So that's feeling pretty good there. We get the glute now coming down. I'm going to give it an angle first and then come back in through here. And of course it wraps, remember it's wrapping around and coming back over now. And it's going to sheath over to out through here. Of course we're way up here now. And come on down to ultimately wrap around the trochanter. Trochanter is going to be up higher now. It's going to be actually, this is a bulge, this back part of that form coming through, and roughly right now going to be more in through this area, so a little bit higher. I have a feeling I might be off on that a little bit. So now we're going to come through the glute over, crest a little bit higher. Okay, so I've got to continue to adjust, and I'm using that shadow to see where that's coming over the fold here. Then we can start to feel this come in a little bit finer. You can start to get that buttock line through here a little bit, then downward, and then we'll get this glute on its way. So remember, this is pulling over, sheathing. So all this will be pulled, sheathing over the crest, the outside part of the crest, down and through, and hitting that trochanter over in this area, right here where that shadow is, just a little bit. And then pulled around, like so. And then we get down now to the end of the glute, roughly in through here, and on over around. And it's starting to pull, band in through here, then get a little bit lower, and it'll continue on. You can see a little bit of bulge where it wants to start up. Then it'll wrap its way around to the back up and through, and then attach to the linea aspera, the rough line of the femur. So we come over and we get this nice great bulge after this trochanter coming down and back on in. Then we start to bulge out here where we get the Vastus Lateralis. So this is going to come over, get this bulge, and then start to come on back down. So we got to feel this coming on back down to that iliotibial tract on the outside. So we start to see that. You know, we could come over, and I'm going to continue on with the glutes now. So I'm going to come across the opposite way of the glute and come this way now, over. So she's moving, buttock moving this way. This tends to be more of the ischial part in through here, and you can see where this form is of the shadow right in through there. I can go a little darker now. so I'll use a little different colors. Right in through here. This form where the shadow is, where the form shadow is, also kind of flattens out. It gets a little bit, what I'll call like a little bit of an ischial flattening, where it's attaching underneath that ischial part over and down through here. We start to see underneath. I don't want to get you confused to shadow to form, but this will start to, for now, we'll feel that shadow roughly in through there. Yeah, I reckon this is coming around. We'll pull that later on. We'll start to pull that around a little bit through here. And so we get to the crack here, or the split of the glutes to be more exact. Gluteal split. And then across, of course this is cast shadow, over here across from the right flank, over and through there. So switching back color a little bit. So here, get some flattening. Now you can see where this also flattens here, right, roughly coming around. This will come around later on here. And then we'll get now to this bump bulge here, flatten through, and then start to come on down and head on over to the other side, over and through here. So let's get now the back of this leg. So in through here we know we have the semi-tendinous membranous right in through here, right? So glute comes over in through here, this darker area, that's overlapping now. So we get that. This is the split here. They split and start to split apart. Okay. And you come down the other side. This gets a little bit flatter right in through here. This boxier part where it starts to turn downward away from us in through here. So we start to see that. That line can be a little bit thinner as we go through. And start to pull this curved. Through there and downward. Looks like a tube, doesn't it? Tube and curved part and through here, underneath. See that? Then we see this nice folding banded crease in through here. There we go. Got that going. Then we're getting the back of this leg now. Semi-tendinous and membranous in through here. And where we headed out to. So let's get our gesture here and over, right? And then we're headed down here, coming across this form like so. So this gets bulgier in through here. Now you can come across over here, hit this to help you out. So we're coming down the leg. What is this? Vastus Lateralis and then iliotibial tract. And we start to see down here where the muscle, about where the knee will pop through the, right through here, start to bulge inward and take off back this way. So we're getting just the side of a little bit of that lateralis back right in through here. So can you see that? It's really subtle. This actually, this overlap wants to come in now and be very subtle in through here. That's a real subtle part right in through there. Okay, bulging through here and around, and we'll pop, feel that trochanter come out a little bit further, right in through, up and through here and around it. Kind of in this, now in this area, we've got a little cast shadow coming for her here. Let's finish this out, and then we'll crest, top out the crest right in through here, right, and then around and back over and through there. So we can feel that coming over. Feel that here, and then we'll soften this back up a little bit. Soften, soften, soften. Through here, getting on this all work together. So we can feel the vastus lateralis over through here, coming through. Over and down just a little bit. So this flattens out a little bit. It's turning over and then it's flattening a little bit too as well. Alright, so we have that coming on down, and we can start to see now as it flattens down. Let's see how this bulges in. It wants to go in now. And then it wants to come on here down and over to the condyle and then attach over to the fibia area, the fibia, right in through the front there. So it's in the middle area of the tibia. Okay, and then we get what is now the biceps femoris in through here. So what we see here is a little bulge right here. Okay, get this bulge in through here, flatten that out. And I want to get you confused out here. This is the biceps femoris tendon. If I got you confused, not to be confused with the iliotibial tract. It goes back now underneath and around. So I want to make sure that was clear. Sorry if that wasn't. This is the biceps femoris tendon. Okay, this is turning this way. Now in this photo, this reference, we don't see the head split. A lot of times you won't. But what we're noticing here is in the shadow. This is the shadow now, coming up and through here. Okay, is that as this turns underneath, this is the buttock head. This needs to be a harder edge, and through here this disappears right underneath and goes underneath and starts to want to go back and attach to the linea aspera. This extra part will come underneath here and over. So we get that bulging, then we get this pull under back underneath, then we get cast shadow, form shadow together, moving this way. All right, so this is going to be the shadow here, is going to be now the biceps femoris area here. You can kind of see it in through here. Okay, it's coming up all the way here and attaching back up to the ischial tuberosity. So we might see a little bit. We're really done. I'm going to push it a little bit because it would be right in through here where it'd come up and go underneath all that buttock region. I'm going to go darker here. The only drawback to these waxier pencils is they're a little tough to render in shading. Get to dark too quick. They don't go dark too quick. It takes a while. So that's, charcoal's better, but it's, for now, for a process, just for you to see this is okay. So anyhow, so biceps femoris here will come down. This is the lateralis, the iliotibial tract, and then it disappears. So this comes up and over biceps femoris, just a little bit, and it softens out. And so all of this now pulls, this contouring, this wants to pull around. See how it turns? And then we have the tendon, and then we have that bulkier head of the muscle. See that right there? That's that bulkier head coming on up to the middle. Okay? Then it meets up with the cast shadow there. So it's form shadow down here and cast shadow. So I'm going to put all that here, and I'll put all this in shadow too as well now to help out. Cast shadow through here. Got all that working for us. So that works. It's working there for us, meaning that it's looking like it's supposed to. Underneath here now, we have the glute. Be careful, this glute is here. So we have this back part of the leg here now, and the glute, since it's tilted, is attaching to the ischial curving. The right glute comes over, you see that. Okay, it's the larger butt cheek because of the positioning. Cast shadow here around the form. It's kind of a flatter view there. Then we come on down and we'll dive in, and where they split apart completely against the sacrum, we'll be there, and you'll see a little bit of that straight softness play out right in through there. Then gets in through there. A little bit of a spinous process poking out on the sacrum, right in through there. And we can get a little darker, right into the little spinous process, right. That little bump, you see that little bump? You see what she has there? Just barely. Around's a little softer into there. This wants to come over. Then we start to see the Erector Spinae starts to emerge out pretty nicely. Through here, the top of the sacrum is about right in through. there. So this wants to come around now. And under here we get darker. So we have to be careful with our line. It's not too harsh. Through here, and this wants to turn. You should keep it here. This head of the buttock of the glute in here, and this gets a little bit flatter as it comes through. And over, we're pretty good for a turn there, I think. Softer transition through here. And around, so we'll get that cast shadow on her, right in through there. Play off that. So cast shadow, and then it goes into form shadow and softens up a little bit, doesn't it? And through there, form shadow. This is important here as we get a little bit of shadow toning. That's it. We'll get a little contouring around it. Okay. Glute into here, darker cast and form shadow. Underneath here, there's a little gap in between. That's just the semi-tendinous and semi-membranous area through there. Be careful of that. So, now back over here we have an attachment to the Biceps Femoris. It's semi-tendinous and semi-membranous now over here. So we have this bulge a little bit. So remember where we're coming to. Here, right in through here is where they split a little bit. You get this little undertow right in through there. So this happens here, right? This little curve. And then we come on down. And then the semi-tendinous is right here. So we're looking to connect, remember, across right here, where we're going to meet up to the other side of the pulley. Right in through there. And so I'm going to come down, come through and down and curve over, and then boom, there I am right there where they connect up. So now this underturns here, but by doing so, we want to get this feeling of overturn like this. That's where they get bulkier. Students miss that. There we go. So we get this overturn to get the underturn. And we get this coming over now, like so. Of course, all this is mostly in shadow. So this comes down in now, and is the tendon connecting to the tibia through here. It gets a little stronger. We see that, and then down, right, and the gastrocnemius starts to come out. So the gastrocnemius wants to come in, up and around and finger over the condyles, okay, of the femur, up and over. That's kind of what we're getting here underneath, and kind of over too as well. This will soften out. Okay, so we have that. And then we have soft form shadow into here. This will get a little harder, and we can put a little dark against that. Okay, so all this could be buried now. A little stronger shadow through here, just to coat everything in a shadow tone. And I can come back and start to delineate, clear up a little bit. So I have this coming out. It's a calf muscle down. That would move over through here. A little bit of form now for the Biceps Femoris. Softer shadow through here. This is gradually turning over. I'll keep it in red since it's on the lighter side. Through here. And shadow here. This will turn, like so. Biceps Femoris tendon on this side. Okay, and over. A little bit more dimpling in through, and it gets buried into the bulk of the muscle. As it comes over, it meets the Vastus Lateralis over through here. That's why we get that a little bit, and this wants to kind of underplay and turn it through here. Get a little bulgy fats. Not a whole lot, it's not a very pretty fit model. So we get that. This will soften over here, soften this underturn. And then we get a little bit of this cave, what I call a cave. This is where The undercondyle into here, the gastrocnemius, will come up and tendon out over and come underneath like fingers. We'll look at that in the lower body, lower leg section into here. It's about ready for some darker shadow, core shadow. So we'll come in through here and this curves over nicely. So we get the shadow pattern now to help us out through here. Okay. This will come on through. Gonna darken this a little bit to make this pop out. This little soft core shadow in through here. Soften that out and put some contour line on top of that. A little top in through here. And underneath some fat gathering right in through here. And softly coming around. There we go, for that. And then some core shadow. This is cast shadow. And through here, coming over and around, a little bit harder edge. And then it softens up here. Rounding out here. Let's see. Here we go. Yeah, rounding out there. I got lost for a second. It's easy to get lost, isn't it? Sometimes you get into these specific areas. Here and over. Coming on down. This gets to be a little bit more angled, so we'll soften that up. Fill this more in shadow. And then right in here where that tendon hits, so we've gotten darker anyway. Right in through there. Ridging over this little arch. Softly turning over to the other tendon for the semi-tendinous and membranous over through here. And then the calf just wants to come gracefully out from it. Here. And on downward. And that's part of the condyle now. And you can see just barely where that starts to split apart. Right in through the gastrocnemius. We'll get into that at a little bit later date. For sure. And I think we've got just about all the parts now that we need to make this another finished little anatomical study. Notice how real bony right in through here pops in and out and over. Here to there and to over to all the way in through and around. Of course she's got a little cast shadow. I'm going to eliminate it. Put that on there just for effect. Let's put a little bit of light where we need to. This could go maybe just a little bit darker where it turns the other way, so we can get that to pop for us. That meeting of the Rectus Femoris and the Vastus Lateralis, roughly iliotibial tract in there. Okay. Let's put a little light on it. And we can see that basically just coming up through here, maybe by the cast shadow to make it really pop, so we can kind of pop over this a little bit. And then maybe up in through this area. And then over this stuff just a little bit, and I think that's enough. Okay, all right. So I think I'm ready to go on to another study. How about that? Let's try that. Let's try another study. Okay, our last one. So now we've got interesting, challenging position kind of in front. So let's figure out now spatially how we attack this drawing. So we're going to kind of go for the hip pelvic region and through here. So the aspect is down in this direction, moving this way. Okay, we see that. So we've got now the leg, the hip together, and we've got that area now of the belly coming in. So that means that the pelvis is kind of down, turns toward that. So what I'm looking for now, I'm running through here, what I'm thinking about where that pubic notch is, running through here, or the pubic bone, pubic symphysis coming down in this direction. So about running through there, I can kind of mark it, kind of come through all the way and then down further, that we don't get any of the genital area in through here. So we're looking at something like this. Now, I would probably conceive of the whole thing as a bowl, kind of like this and over. All right, and then downward, coming through, you know, tilted downward and over and back in through here. Putting the hips now back in the hip, the trochanter now probably back up roughly speaking, right up in through here as I mark it a little bit, and then I come on over to the other side and we see more of the flow now of the belly area in through here, the rectus abdominis and the fat through here. Now he's tilted inward, coming inward and a ton to the side, so his pectorals come all the way down. It's a pretty difficult pose to hold. The pectorals are roughly kind of running through here. Center line in through here, we don't see the belly button. Pubic symphysis is about somewhere in through here. Gesturally now for the leg, the upper leg, coming out through this region. Okay, so we're coming on down and we get all the way down here roughly to where the condyles or the kneecap and patella are in general. So get that kind of side twisting of the leg view in through here. So kind of downward like this. We're thinking about boxing it through and over, just finding the outside kind of like that and over, with the top being about right here and the side plane being topped down and through here and over, and coming in and through. So we see that around, and the calf will come in roughly behind all that material as we get these condyles, and the tendons will sheathe over that to the patella region, roughly the side I'll mark right in through here. And I could be wrong, and I'll have to change it when I do. So we have that. Now we're coming back up. We're getting a greatly foreshortened leg, which is good to see here, covering over some of this now in through here. So we get, I'm just judging where to take that knee into, right in through here, roughly right in through here. So we're coming up, I'm feeling where the top of now the medialis muscle is. We can identify that. It's kind of a classic box here, moving in this direction, up and over, and then it tops out here where the 3-finger gap roughly could be right in through there. Can you see that? Up in through there like so. Then we get wider even, then I think I've got it. And then coming on down, and then over. So it's kind of like a bread box. I feel this is kind of the other part of the top in through here. So right in through there, we turn over. Here's that front plane, roughly. And all this, the knee, patella region really wants to turn downwards. You can really see the patella coming out. The condyles of the top of the femur really stand out here, roughly, right? And also now on the other side by the medialis, bulging out on top with the sartorius underneath and the gracilis. And we see this triangle now. See the triangle of the femur underneath, right in through here. So condyle side here, the lining is from the top right, forward from him, and then we have this over through here. So we get the strong triangle. Do you see that? Right over and through there. So that's a strong triangle to see. Okay, so now we're getting the foreshortened tibia and fibia. Here, let me move the fibia now on the outside over here. So all this is now turned downward, right, as a box turning down. So we're here, and then we're turning, right, and then we're coming back underneath, like back up like so. He's sitting roughly here. Feels pretty good where he's sitting, right in through there. Okay, then we come back in to the leg, and we can see that this would be a little bit of biceps femoris under here, and the tendon will come. Yep, we're in good shape, and through here down low. And of course, later on we'll hit underneath here, and it will attach to the fibia, which is right over here. And then we can start to feel now the calf muscle coming underneath all that. So let's feel that just through here for now and around. So the axis, its length of its width is roughly here. The widest part now, cross and over, about right in through here. Okay, be a little bit lower, right in through here. Now downward, up and through. Okay, and through and wrapped around, and it's going to take off gesturally down to the tibia, and you see how the tibia is curved a little bit, that tibia-fibular curve coming over, and then we get to the condyle later on. That will be, of course, the ankle, and we'll just pretty much leave it there. This can be even greater or greatly expressed in thickness since it's flattening out on that stool chair. Looks like it's from IKEA. I think I've seen that before. I think I have a white one here in my office. Just kind of like it. Okay, just kind of like it. All right, so we're getting everything laid in now, and we can start to focus in on some anatomy. And through here, this is a little bit more of a split. So this is a little bit thinner in through here. So we can take now the belly region in through here and move up. So it's a heavier gentleman, less structural bone or muscle tissue, a little bit more of the fattier processes in through here, pectoral coming out through here and downward, and that's all we'll study there for that. So now coming through over here to this ending point over here, so we get right in through here this belly region, and then curving over we get more fat, and it's pulling over now, isn't it? Right through, well over into the middle part now, right? I think roughly put it in through here. So this all pulls downward like so. So we have that. And now we're getting this little crease right in through here of the rectus femoris, underneath, coming underneath it, because it will come back up to the inferior superior aspect of the, inferior anterior aspect of the pubic or pelvic spine area. All right, so we have coming out here, rough bulging out now is the rectus femoris, and then the lateralis just a little bit over here, and we're going to work our way down right here. This is a little bit long, I can see now, so we're going to bring it up a little bit to here, probably greatly higher in through here, it looks like. So reposition that, so we'll always adjust our lay-in. So now we see a little bit of the rectus femoris, the femur, want to come over here and then start to emerge right over here. So we have that. Now we're on the patella, right in through here, right? So look how far I missed it, so I had to bring it back on in. So right in through here now, okay? And then on top and over is the other side of that bone. So that patellar bone right in through there we see, okay? And down. And we get that, and then you can really see the tendon and ligament coming. Look at that, how strong that is in that view. So that's why it's really important to get in front of models now in reference to practice those diagrams. Diagrams on their own are great. You want to memorize them so you can draw them. But then you want to get in front of the forms and see that. So now we're on the side knee. What is this? This is the medialis, right? So we're in through here. We know that teardrop shape in that side view. Up and over. We'll follow the shadow a little bit up and through to about here, right? So we'll follow that shadow downward, and all this will be in shadow underneath. So we have medialis here, okay? Put all that in shadow there. So we have medialis, and then underneath, right about in through here, it starts to end, and we get back to the end of this leg, and we start to get Sartorius right in through here, okay? And we come over, and we're going to get now the side of this knee area, and we see patella, so that means the medialis is a little higher through here, patella side there, and then we come over here, we can see a little bit maybe of the condyle. You see that? A little bit of that condyle right in through there. Okay, and then down and over. And all this is in shadow, side of that leg bone now, of the tibia femur region, in through here. Triangle, and this will push in now. So we're definitely now beginning on the tibia, since we're down here. Patella wants to come on over. Okay? And now as we get past this little region here, the condyle, up and through here, okay, we get now the flexor We have the semi-tendinous and semi-membranous right underneath it, right in through here, okay? Coming up. And then the adductors start to emerge, and we are coming outward now. We can start to see it gives you that bulk here to here of the muscle. So these are the adductors now, and through here turning this way. Okay. Up and over and through, give you a little bit of bulkiness and through here, and it wants to come over. Now there's a little minor shadow up and through here, cast shadow. I'm going to forget that for now. We have more of the adductors in through here, okay? Through here, coming through, bulging and coming down. And we get that Sartorius really picks up early. Remember, it's that belt muscle coming all the way over and through here. And this will be in shadow. You can pull that in shadow in through there. And then down, and we're doing pretty good. Looks like pretty good in through here. Headed a little bit more the Medialis Sartorius region. Now coming over here, pulling this over, okay, we get over into here, Rectus Femoris, and it's not very predominant. It would end up and over here, about right in through here a little bit, but it's not dominant, kind of where that shadow is. And everything else just really falls kind of over, doesn't it? In this direction. And so let's finish out this knee area in through here a little bit. So back behind it now, we get the semi-tendinous and membranous connection. This is the Sartorius and the Gracilis right in through here, right? This condyle. And then back behind us where the tendons are for the semi-tendinous and membranous, and then we get over to now the calf in through here and over. This wants to now pull around, okay? So patella, and then patella ends. We get this interesting little side view here. And we get now the rest of the tubercle of the tibia, that triangled area, and then we start to get, we shave it down this way, we start to get now into calf, gastrocnemius, down and in. And I'll leave it, I'll kind of just fade it out after that, and then we'll get the shadow here of it. Okay. Really pulling around. Interesting viewpoint. We get this rhythm now coming back up, pulling over here. Sartorius sitting on top, pulls this direction also, the Rectus Femoris. Right in through there. This bulges back in. And then we would get a little bit of more material from the front of the model's belly region. So let's darken in some of this now. We did this side. This coming in and over. Okay, and through and down. Going to review here. Abductors coming through, and we'll get this calf, not calf, knee in a moment to really get it squared away. I'll make some adjustments and changes there. Coming over and in. Adductors in through here. Shadow, and then we get adductor core shadow, and that also leads us to tell us the form. So it's moving in through here, okay? More so adductors as they attach in through here and around. This tends to flatten a little bit as it moves this way, and then wants to come around like the shadow starting to indicate through there. So we get this up and in, the adductors in through here, and we start to see them bulge in through here. Okay, right in through here on the more peripheral region. Okay, so we get that in through. And we get this turning in here. And up. We'll bring that in a little bit. There we go. Sartorius sort of belting its way downward a little bit through here. This will come up to the Rectus Femoris. Okay, and the Medialis is over through here too, all that together. through here. And we get that downward motion, and right in through here is a nice split. Right in through here, and this becomes semi-tendinous and membranous material. It's back behind, so it's got to be behind it. That means that this condyle area, over and through here, okay, right in through here, coming over and through, up a little bit here, and around to the patella. That means that's in front of the back of the leg. The calf goes behind it, so does the semi-tendinous and membranous on the posterior side. Then we get into now the patella over here. Okay, coming around down. Right in through. Okay, and over, cast shadow, so it's a little bit darker and a little bit harder edge. We get this edge. I'll do it red on the lighter side. I tend to do it a little bit lighter, show like a light. And this bulges here. Working that contour line through that shadow line, which can go dark, just playing around with line color and space a little bit. 3-fingered gap and through there. And you see how this turns in? That's where that overlaps a little bit. Right in through there. That'll overlap around. We can do this just a little bit. Turning those forms through here. Then we come over now. It's patella. Right, we've seen that before now. Back, ligament and tendon, and in front now. And now we get a little bit of this side view. So make sure you see that, because here's the side of the tendon, like a little box, and ligament here, more condyle, splitting together, touching together with cartilage in here, but in light a little bit. Then we have the not the iliotypical, but the Gracilis and the Sartorius coming through here on over, right in through here. It's important to see that. This makes a little nice sheet. It really looks like the bone now as we even draw it through without drawing it diagrammatically proper. Right in through there. There's the side of the tibia. Remember, the fibia is on the other side. It's on the lateral side. I used to get that wrong for years when I drew out of my head for practice. It always frustrated me. Here, and then we'll come underneath the calf, and then we're going to get this turn here of the gastrocnemius, and then we'll just kind of flatten this a little bit, and then we'll end it through there. This will come around a little bit like so. Okay, so we have pretty much everything we need now. It's what's interesting to hear how far the patella is pushed over. It's like the leg keeps coming over, but then it goes straight. So it wants to turn, right? Then it wants to go back and go straight. It's a really interesting change, I think, on the leg with it, because then it comes down and further down and through there. So these are interesting little condyle projections here, in between. Get down on through. All right, so we put a little bit more right in through here just to get a little bit more definition. Right in through here and up. Let's go now to this other side. Feeling pretty good on that side. So let's start out back in red. Let's see how I did. So we're coming up over here now. And this feels pretty good now in position. So this was a much better change. Look how much longer. So you've got to make your changes. And look how this, where I missed, just disappears when you draw over it. That's why you want to draw lightly. So it's hard for my students sometimes to really understand that don't worry about making mistakes, is that you just draw right over there. So we've got now the rectus femoris sitting right on top here. Actually, excuse me, this is the medialis. A little bit. The femoris would end a little bit further in, but we've got now the medialis here. It's kind of like the front of a box. Here's the side of it. The rectus femoris would be up right in through here, coming around a little over. So we'll see that coming through and over now, and around through here. Then we'll come up a little bit high. This is going to go higher, so we'll come in higher now, and then we'll come around. Pull this in rounder, Okay, so this really wants to come over. The shadow takes us over, so this is where we start to say, well, that turns in through here. So what is this? This is Sartorius over the Rectus Femoris a little bit. And they're going to come together here in this view and then start to really, you can see where it pulls into that belly area in through here and where the fat comes through and through here. It probably does this around. See if that gets in the camera. Yeah, it does enough. And this is going to just kind of turn over and fade to the back and through here. So that's a real strong line in through here. Then we push up and through a real strong line in through here. And then we're going to turn this way. Get a little, probably a fat pocket in through here. And then this is really going to hit our hip, that ilium area in through there. So I'll go black. In through here, up and over. And then we'll come on the other side and we're going to get some movement now. This is going to be stronger subcutaneous fat over that area. Okay, so we're getting close to the trochanter area through, then downward. That felt pretty good. Into here, over and around. We can see where this bulges. It's kind of squared off, isn't it? It's a little bit higher. It kind of squares off in through here. That iliotibial tract from the glute can get a little boxy. Then it's going to come around in through here, and he's going to start to sit down about right in through here. You can see where that little darker area is over and through there, and it's pretty decent. I'm going to draw a line across. Pretty decent. Maybe a little bit higher, but I'm okay with it coming through. This gets shaved down, so we're just drawing our bread box again underneath and around and over to find our placement right in through here. Now let's kind of start to think about anatomy too. Well, obviously anatomy, since that's what we're studying. We don't want to kind of do it. We definitely want to do it. So let's go back and start this kneecap. You know, I think of this kneecap here, you know, as the downward turn of the box here and here, and here's the box, right? And it's kind of triangled off like that. So we get this great condyle turn in. Let's bring it in a little bit more. So let's do it in dark. Let's bring it into here, really show it off, that condyle with the medialis back behind it, right through there. So the condyle is here, right? Where's the other one? Now let's go up higher and a little in, and there it is on an angle. Okay, here it is here. So there's that condyle there. Connie the condyle, or Kurt the condyle, whichever you prefer. The condyle right through there of that bone. Now remember those kind of bulge out to this little shape. That's what we're kind of seeing in through here. And the patella is going to be pushed down. So we're going to see this side of the femoris and medialis area over like so. And this comes in, now watch this dark area comes in, and what do we get next to it? Right in through here, this is the front of the knee, and we get the patella all lit up. So right in through here, around, okay. Here's the top of the patella. Here it's really light, we can get it with light later on, but here's the top, and then here's the side turning down right here in shadow. And coming on down, it's kind of getting buried in there, but here's the bottom part of it, right in through here. There we go. Through there and around, a little bit bigger. And here's the side aspect, and it's really wanting us to point downward. Now take a look at it. See this little funnel shape? We know what that is. What is this coming down? That is the tendon and ligament area of the patella coming on down to the condyle now of the tibia. Right in through there. It couldn't be more done for you, right? In through there. Okay, so that takes us to our edge, really roughly. So I needed to bring that in. That's okay. So this comes on in and over. Okay, and out. And there we go to that area. Coming nicely. Bring that leg back on in. So we have that in through here, the little tone in through here, underneath that triangle. The whole thing's a triangle, and it gets more rooted and stemmed. There's the bottom of it right in through there, And then we get over here and around, underneath here. Now we're to the side of the condyle, starting through here, patella, right? So we're kind of mapping out that shadow underneath the condyle and right over and through here. So we know that we're starting to get to be on the iliotibial tract area, right? Because we're on the lateral side. In through here and up around. All right. So watch this. So I know all this is going to be in shadow, so I'll start to put all this in shadow for now so we can draw through it. We mark that shadow. Okay. Then we'll come around. Okay. You're never going to find, I'm going to have to go higher now. We're going to have to find back where our thigh was. So this is definitely the iliotibial tract area. Cutting in, right, in through here, because the middle part of it, right, in through here, and then we see the rest of this condyle area. See it come down even higher. There we go. Now we're cooking. Back to where we need to be. Because you have to know your geography you're drawing. Through here, make that nice and dark so we can see that. So we're seeing the side of that. Now I'm just going to take the shadow right in through here and just see how this comes up top, and it's going to turn over. But now let's find some muscle through the shadow. So what we're seeing through here, can you see that line right? Roughly in through here, rectus femoris on over here. Okay, right in through here very softly to now the it's ending over here, medialis coming through here, and it tops off. It gets square. I don't have to write. Best paper for tight, really tight contour lines. A little bit. It's like a cheese grater paper. There we go. So we get to the side of that medialis, right in through there as well. Okay, so we're the side. Now the patella in through here. And around. Okay, like so. There we go. That bone region. Really taking it downward now. In there. Now all this now is going to be in shadow. In through here and around. Okay. And then we can say, okay, where are some muscle forms? In through here. So we know we come down here to the side and this curving, this coarse shadow, that's where really the rectus femoris is turning in through here, getting into the lateralis both together. They don't really distinguish and mark out that much. So we see that coming through in these little bulge humps. You just draw kind of what you see there, what you know a little bit, and so that will go a little darker through here, this whole coarse shadowy kind of area, getting back in through here, get to the trochanter area, roughly in through there, make that a little darker, come around. So we start to see that coming down. This gets a little flatter in through here. You can see that now with the shading, on the model in through here. This bulges underneath with the end of the lateralis. Wants to start turning into the glute a little further in there, coming in through. This starts to come through now a little bit too. Wants to start to indicate the biceps femoris, this little dark bulge I put underneath here, which could still probably go up a little, all of it a little bit, and start to see how it starts to curl up. You see that? It indicates that the tendon is starting to become there. And up through and over, and here's the side now of what is the iliotibial tract area in the middle of the leg, laterally. So we start to see that bulge out through, properly lower than in through here. Okay, see that? Cast shadow. Side of that knee. And now we're going to feel now this calf bulge here. Really could be, I'm bringing even more up, cussedly. About right in through here, so look how much lower I was. So let's bring it up even further. And as it's creasing up underneath, you get that bulge. It's much better. This could be a little bit narrower. And in, that'll side out. So we'll put this shadow on the calf here, and this has a tendency to turn this in this way and over. And we're just getting there. Coming through here and around. Nice and bulgy in and bulge out again, and then hit the tibia. The calf comes together, and how round that is. It's a nice kind of feeling to get that coming through and down. That gets us to the condyle now of the ankle. Down through this gets narrower pretty quickly as we come on down and split that. Let's come back up here and get a little bit cleaner and clear, and we'll be just about done. I promise. Through here, coming over, trochanter area. Okay, tensor fascia lata area bulging in, 3-finger gap, and through here, right through. Okay, this wants to crease. Come over that way. Okay. Coming over, feeling the Rectus Femoris and Vastus Lateralis together, and then we start to feel this, the bulge here, the Femoris Lateralis kind of area, and they tend to, this is smaller than it still. There we go, bulging in. Sorry about that, I'm going to continue to correct this. Well, don't worry about drawing over it. For heaven's sake, this can be just the clothy area. That's it, coming on through and out that way. There we go. Up, because this is biceps femoris turning up and then disappearing again right in through. Biceps femoris coming in through here. Down and through there, and then getting into that tendon where it curls up, and it gives you that strong crease area. Then that calf wants to flow and come out like so. Tibia region, sartorius region, excuse me, iliotibial tract region. How about that for catch up with these? So again, you'll forget names, or you'll, as you're talking and drawing, you'll miss them sometimes, like I do. So, condyle here, up and over and around, through. That bone is really turning and kind of moving and bending towards us, and let's get that shadow underneath here. Okay, and around. There we go, fitting it through, moving this area, and then we start to get the rectus femoris, Vastus Lateralis area, and then we can start to render a little bit more of that core shadow in through here. It kind of bulges like to a head, or curve, and you can try to draw what you see once you know these things. You just draw also what you see. This area turns downward. It's this core shadow that runs in through here. This has a little flat area here, and then that reflected light tends to come underneath like so. I'm going to catch this back up and recapture this area. There we go. Capture that underneath, a little cloth underneath there. Pull that through, that's better. This comes around like a tube now, doesn't it? So it's boxy under here, and it's more tube-like at the top, right in through here. Do you see that? That's important to see. So a little bit more here, really ending the rectus femoris here on its side. And then iliotibial tract and the vastus lateralis too. Coming in through and around here. like so. And I'll put a little tone in the belly just so we can see that. It really is the pectoral coming all the way down. How about that? Through here. Okay, kind of the center line. Abdominals, we don't get a whole lot, we don't get any of that. Through there. And let's clean up this area on top of the condyle. Right in through here. Let's make that come down and over. And I want to clean this area back in through here, so we can see this a little bit more cleanly and clearly of our anatomy. Naming and drawing, getting beyond the diagrams, the living anatomy. Get through here, wrap around, wrap around. Just about done through here. I think we've got just about now everything we need to call it a day. Well, we can put some light on, can't we? Okay. Right in through here, the side of the patella. All right, let's do that now. Let's put that on. Okay. So I put red on contours for the outside of the leg. And for the darker area of shadow, I put black contour just to give it a little bit of a different feeling. It's a technique you pick up from Rubens and from Watteau, others. This will pull back like so. All right, let's put a little light on there and maybe just a little bit more of a coarse shadow. Sorry about that, just to make this clear right in through Patella region and on up. Right up and up and through and around. Okay, let's put a little light on there. How about that? So coming across here from the patella region, we see this little highlight here. And on the side of it here, don't we? Patella, we're on the patella, coming down. And then we have a nice highlight on the medialis, roughly in through there. And then maybe on this condyle here, at the top of the femur with a little bit of the connection of the rectus femoris, tendon, and medialis. And through here, and then maybe down through here on the patella over. I'll put a little bit of light in through here and a little bit on the calf. And I think we'll call it a day. So there we go. That's living anatomy now with the upper leg. Hope you guys enjoyed it. And we'll continue on now with more anatomy studies in different areas as you see fit. Or if you're getting assigned from my students. All right, catch you guys later. Take care. See ya. Bye-bye.